Good morning, everyone, and welcome to Unity Healthcare's Galen Street Clinic. And we're so happy to have you here. It's delightful, and we specifically brought the sun out for you. What's this about a storm? No storm, no storm. The mayor said I prayed for it, and my prayers worked, right? We are so happy, especially to have our mayor here today to share with us the status of infant mortality. We also welcome Dr. Levin, who unfortunately will be leaving us soon, but has done a wonderful job and has had a partnership for Unity, not just in the last couple of years, but in his position, but has always had a very good working relationship with us. Commissioner Mohammed, we welcome you as well. So I will just do nothing other than to say that one of the greatest allies of the work that we are all trying to do in the city in the area of improving healthcare has been the mayor. He's not only done it as mayor and as chairman of the city council, he's done it in his work in the private sector, in the nonprofit private sector. So it gives me great pleasure to introduce the mayor back to the clinic that he opened last May, and just tell him to put on his calendar the opening of Parkside later this year. So, Mr. Mayor, welcome again to Unity Healthcare.
All right, well, good morning, everybody. I am absolutely delighted to be here with Vince Keene, who's done such an extraordinary job over the years helping to lead our community health efforts here in the District of Columbia. So Vince, thank you very much for what you've done and for being with us. As he indicated, it's been about a year. I think it was May 7th, I think, of last year when we actually dedicated this facility, which we know is already making an important contribution to improving health outcomes for the people of the city, and especially the people of Ward 8. I want to recognize Commissioner Anthony Mohammed, who is here as well. Thank you, Commissioner, for being here as well. And we, of course, appreciate your outreach efforts in so many ways, including the health of the people who live in your single-member district as well as in Ward 8. I also want to thank Dr. Saul Levin. As Vince indicated, Dr. Levin has been named to a phenomenal position. He is going to be heading the American Psychiatric Association, and what a great job that would be. We appreciate his commitment to the city, and of course we wish you the best, Dr. Levin, and appreciate again the work that you've done during your time as interim director of the Department of Health. I also want to thank the Department of Health staff. Infant mortality is a long-term journey, and you'll see in just a second how long-term that is if you really want to be able to make a difference. So I want to thank the Department of Health staff. I want to thank all the community-based organizations and all those who are part of the health community to be able to bring us to where we are today. Especially those who are responsible for expanding primary care and prenatal care services to women and infants here in the District of Columbia. Today is the day when we are proud to announce that we have once again significantly reduced the rate of infant mortality here in the District of Columbia, and to my knowledge, it's the lowest rate that we've ever had since we started recording data here in the District of Columbia. It takes a while to do the epidemiological studies that are associated with this. We have to work with the CDC and others at the federal level. So what we're announcing today is actually the 2011 rate, the work that we did during 2011. And later this year, hopefully, we'll be able to announce the 2012 data, which is a period when this clinic was actually open and operating. Again, our rate is 7.4 infants per 1,000 live births here in the District of Columbia. That is a huge drop over time. We had 69 infants during 2011 who were the victims of infant mortality. For those who don't know, the definition of infant mortality is those children who perish, who die before they reach their first birthday. And as Dr. Levin and I were talking yesterday, many of those 69 children are people who are young people, babies who were premature and didn't make it to really through the first month. So if we can make it through the first month, these children have a great chance of being able to survive, and that is one of the things that we will be working on in the future. This is a 5.5% decrease over the previous data that we had, which means I think it was 8 deaths per 1,000 live births from 2010. It is infant mortality. A lot of people regard this as one of the best, if not the best, indicators of a community's health. The infant mortality rate often foreshadows other health indicators in a community. So when we look at this, we also are looking at how we're doing in other areas of health in the city. We are delighted to say, too, and Vince mentioned it, we are opening a brand new clinic later this year in Parkside, which is in Ward 7. And Ward 7, by the way, has come down tremendously over the years. Even though it's always risky to look at ward level data, because if you can imagine, if 69 is the entire city, at a ward level is probably many fewer, obviously, than that. But we're also opening a clinic in Bellevue, a clinic that will be run by the Community of Hope. That is under construction as well, and we think will bring more primary care and more prenatal care, OB/GYN services to folks. One of the things I'm especially proud of, Vince was talking about my history. My history also goes back to the Department of Human Services. I was the director of the Department of Human Services when we established a program called Healthy Start. That's now been about 20 years, and we knew at the time that Healthy Start would have a significant chance of bringing down infant mortality, because that's what its aim was in particular, to bring down infant mortality in the city. And we focused a lot on outreach, prenatal care, whatever we could do to reach vulnerable young, pregnant women. At the time, it was an astounding rate. It was 21, 22 deaths per 1,000 live births at the time. And now, over these almost 2 decades, we have come to a point where we're down to 7.4. So it's not only the Healthy Start program, which is a major factor in it, it's also helping young parents understand how to create safe sleep opportunities for children, because we've had situations where babies have died as a result of not only SIDS, but also as a result of being left in a posture that made them vulnerable to suffocating. And then the mobile units like the mom's van. What a tremendous contribution that has made. It has gone into areas, because we can pinpoint where the areas are that were most vulnerable to infant mortality. And the mom's vans, as they have evolved over time, have been able to go into these areas and provide services, prenatal care services to women who were, at the very early stages or later stages of pregnancy. We know that Ward 8 historically has been an area of the city that has been vulnerable to infant mortality rates, and is still, relative to the others, continues to be quite high. And we think, Vince, that this clinic will make a major contribution, because this clinic, for the period that we're talking about, this clinic was not even operational. This clinic was operational for much of 2012, and we're talking about 2011 data. As recently as 2006, we had infant mortality data that was around 20, and we've now worked hard to bring that down because of some of the factors that I mentioned before. And we know that infant mortality is not only a function of good health care, good OB/GYN, prenatal care services, primary care services, but also continuing to improve our economic development programs in the city, education programs, and of course, our public health programs more broadly. So what we're proud to announce today is that we're making progress, but I don't think we can rest until we reduce that 69 to 0. And I do believe that's possible. I'm not sure many believed it was possible to get to 7.4 when we were at 20 or 21. But we have achieved that. I think we understand now the factors that contribute to bringing down infant mortality, and we should all be delighted about where we are at this stage. So for those who are here today, I want to thank you very much for the work that you have done. I ask you to redouble those efforts so that when we celebrate, I guess 2012 is over, so hopefully we'll have something to celebrate for 2012. But when we look at 2013 data somewhere down the road, that we will be even substantially lower than 7.4. With that having been said, I'm going to ask Dr. Levin to come up and talk more about the details of our 2011 data. So thank you all very much for being out. It's a celebratory moment. And I want to thank the weather also for cooperating. We expected derecho-like weather today, and when I walked in here, the sun was out. And we know who intervened in order to be able to make this happen, don't we? Thank you all very much.
Well, thank you, Mr. Mayor, for your continued leadership. It's been a privilege to serve under you in this position. You have been a leader in healthcare for, as you say, close on over, 20, 25 years, even before he was the Secretary of Health and Human Services in the District of Columbia. He was then the CEO of Covenant House, where, as I always remind him when people talk to me about, politicians forget where they come from. The mayor has, when he was the head of Covenant House, realized that homeless youth were at great at risk for HIV, and in a time when it wasn't hip to be outreaching to the homeless youth and talking about HIV, he started programs at Covenant House. So I always say, he's walked the walk and he's talked the talk on this, and I've seen it in this year and a half that I've had the privilege of working for him. So congratulations. I think the other visionary thing we have to say about the mayor is in his term as the Director of Health and Human Services, he realized he had to do something about infant mortality. And when you talk about visionary leaders beginning to start to change a city, he did it by introducing programs, as I said, the Healthy Start program, that today we really see the fruition of that. I mean, we are slowly, in fact, in the beginning, a lot slow, but now rapidly decreasing infant mortality rates in the city. And I have a feeling very soon the district will be at the national average that we can then celebrate how well we've done around decreasing infant mortality rates. I have to also commend Vince Keen, who I've known for close on 20 years in the different iterations of my life as he's spent time at Unity Clinic. We would have lunch occasionally at the diner out on Columbia Avenue or 18th Street and catch up on the healthcare. But for all the health, all this work you've done here in the health in the city, and particularly for the underserved populations that so much DOH is a part of. And we have to really thank you. There have been lean times and up times as well, and we thank you for that. Deputy Mayor Bibi Otero's commitment to the community and her leadership as the head of the Health and Human Services cluster in ensuring that we've worked together, that has also aided all the agencies in the administration to ensure that we've coordinated care and don't duplicate services. And Councilman Alexander for her leadership on, one, taking over the Committee on Health, but also her commitment to creating a healthier partnership with DOH. I have to thank also the Department of Health staff. We have Colette Chichester, the Chief of Staff, and Najma Roberts, the PIO of DOH, who clearly has also been so actively involved in ensuring over the year that infant mortality rates were really up center stage for us. And then we have the Community Health Administration. I know Brenda Kelly is here. I know Karen Watts, who heads up the infant mortality, the Infant Bureau, to really thank her, for all the hard work that she's done. And the mom van and the dad van and the baby van, is all under, Brenda and Dr. Watts. And then we have CPPE, the Center for Program and Program Evaluation and Policy Evaluation, Dr. Fern Johnson-Clark, who's the statistician, essentially, for us, that collects all the data, Mr. Mayor, that enables the CDC to say, you know, what you've done is correct, it's accurate, and it's valid in statistics. And I think that's the big issue as we look at the data you presented today, is that it isn't anecdotal, it's done very carefully, very clearly, and we're now at a point where we are below the 100 deaths in a community, in a city like ours, that makes it basically statistically a lot harder to begin to start extrapolating the very small changes we have. So while we say that you're in Wards 5 and Ward 8, it may have gone up a bit, we're at such low numbers, and don't forget, every death is important to us to work out what happened and to ensure it doesn't happen. But from a population health basis, the city is truly getting a lot healthier, and we have to commend all of those to do it. So today we celebrate the milestone, a success that 47 fewer infants died in 2011 than 5 years ago. A big issue. It may sound a low number, but when you think of the size of our city, as well as some of the disparate care that some of our populations have here, particularly in Ward 5, 7, and 8, that it is truly a remarkable feature. The trend is moving in the right direction, and we have to thank all the community health organizations, the Department of Health organizations, the Department of Human Services, healthcare financing, all of us coming together to try and work out a way to ensure we keep bringing it down. There are three main strategies that play a role in the decrease. One is by improving the health of women before they become pregnant, very important. Teen pregnancy, we've got to stop it. We're going to create new programs in addition to the existing programs at DOH to ensure that we stop teen pregnancy, because that is where the beginning of the infant mortality rate begins to occur. Getting expectant mothers into early prenatal care. You know, if you're getting good care, if a doctor or a healthcare provider is using those sonograms, we can later hear a little more from the Unity Clinic. That is what ultimately ensures that we have safe babies born. And lastly, to ensure the continuum of safe and high quality care after the baby is born. The mayor did mention in those literally that first month is so critical to ensuring that if a baby is low birth weight, does have congenital disease, that we really get to it quickly and help the mother and the family and the healthcare system go around the system, and we're doing that. The department is also redoubling its efforts with the Department of Healthcare Financing to monitor coverage and promote the use of women's clinical preventive services. So important, particularly in the healthcare reform of the Affordable Care Act and also our Health Benefits Exchange Board and the services they're going to bring. Because it is important through insurance that you are able to get that care. And 56% of our infant deaths occurred in 2011 to moms that listed Medicaid as their insurance. So we need to make sure that all those mothers, if they are on Medicaid, are in service, and Unity Clinic is truly one of the partners in that for us. For the fellow data folk here in the audience, and I ask those who aren't quite into data to just bear with me a minute. The report shows that there was a 7.5% increase from 2010. In 2010, we had a rate of 8.5 live births to 2011, a rate of 7.4 live births per 1,000. So really a good trajectory of going down. The rate is calculated, just so you know, is calculated by dividing the number of infant deaths in a calendar year. So we go from January 1 through to December 31st, which is why it takes a little while for us to not only get all that data, but then get it to CDC for them to validate it, and then for us to then write the report. And as you know, with all report writing, it goes through numerous levels to get us to this point that we are today. So you divide that number of live births registered for the same period, and that is presented as a rate per 1,000 live births. So we look at the three top causes of infant deaths in 2011. They are disorders related to short gestation. In other words, the pregnancy didn't go to full term, and low birth weight. Really important. We've got to get our babies to term. We've got to make sure they're healthy within the womb. As the mayor would say, quite another phrase, Education starts, as he would say, if he could get education into the womb, he'd start educating those kids, because we know that that is ultimately what is going to be our future for these kids to not only be healthy, but also ensure that their education is of a level that they'll be able to compete into the 21st century. The next one is newborns affected by complications of the placenta, the cord, or the membranes. You often hear about cords around the neck. This is easily diagnosable now. We've got to begin to make sure we know that. If a mother's membranes rupture early and gets infected, also causes an increase in infant mortality. Newborn affected by maternal complications of pregnancy, diabetes, hypertension, obesity, substance abuse, are all the areas we've got to give comprehensive care. We gather this data by examining the time of entry into prenatal care, mother's age, ethnicity, education, ward of residence, insurance at the time of delivery. The Department of Health will continue to provide what we now call hyper-local programming. So what we're now doing, because our numbers are getting so low, we're looking literally to the zip code and to the block and seeing, is there maybe a housing complex or a community within that area, within the ward, that we can begin to go and say, there's something happening here that you're not getting good health care, and let's mobilize the community and the healthcare systems. In the Latino population, it's called Promonteros, where you basically get the leaders in the community to begin to go, and we're going to start asking the leaders in all our communities, I don't want to say the elderly folk in our community, but the people who've lived there for a while, who know the community, who've watched everyone, who've watched the births, the deaths, and are able to go to the mothers and say, let us help you. So we will start looking at that down to a micro level. And obviously the Healthy Start program that the mayor started, a free program for pregnant and parenting mothers and fathers in the wards, 5, 6, 7, and 8, that obviously, as you see from the map, we have the map, or is it? Yep, there it is on that side. Clearly, as you move around towards the east end, of the District of Columbia, we need to do a lot more work, and we are beginning to ensure now that our programs are clearly diverted to that area to come into the community. We give free pregnancy testing, depression screening, substance abuse screening, domestic violence screening, very big in infant mortality, child development assessments, male support services. It's not just the mother and her child. It's the father of that child that needs to actively involved. Parents as teachers, curriculum, health education, home visitation by our nurses and our family support is the way we ensure the mothers keep to treatment. And obviously, as you go outside, you'll see the wonderful mobile mom van where we will go out into the community, and mothers can come onto the van where they will get care. Keep in mind, as the Department of Health develops prenatal and infant health programs, we also work around wraparound services, such as the farmers markets, healthy corner stores, particularly in parts of the city that don't have good grocery stores and where you still need to get that alternative healthy foods. And the mayor has really helped the Department of Health to ensure that we've really moved that out, along with the Department of Public Parks and Recreations, to ensure that we do comprehensive care for everyone. It's our goal to increase the capacity for all district residents to live a healthy, well-balanced life. While I'm leaving my official role as the director in the Department of Health, I look forward to meeting you all here next year to share the highlight infant mortality decrease for 2012 that I believe will be even lower in the rate and closer to the national average. So, Mr. Mayor, please ask me back to come to that press conference so at least I could see the wonderful work DOH has done. I came in with a Derigio storm. It looks as if I'm leaving with a Derigio storm. But the bottom of the line is this city, through the mayor's work with all his cabinet and his leadership, is a lot safer today, both in terms of disaster preparedness and in terms of health. And we have to commend him for that. I commend you, Mr. Mayor. I'd now like to introduce Dr. Mark Hathaway, who is the Director of the Obstetrics and Gynecological Division at Unity Health Clinic, for a few words in terms of where the pedal hits the metal in terms of doing the work.
Thank you. Thank you very much. Thank you, Mr. Mayor, Vince Keen, Dr. Levin, Dr. Muhammad, and all the colleagues that are here in this room. in particular, I'd also like to thank my patients. I've worked with Unity Healthcare and the Washington Hospital Center for many years now. I hate to count all those years. But what I know about work in the city and work in two of my loves and passions, reducing infant mortality rates and family planning service provision, is really has to do with what I've learned from my patients. And so therefore, I thank them for all of the work that they've helped me accomplish. And these two folks stole some of my thunder. But I'm going to mention what I think is truly what the mayor mentioned, that infant mortality rates really reflect a community. And it takes a village. It takes everyone to be thinking about how can we make our communities more healthy. And as the mayor pointed out, we've done lots of great things in this city to improve economic outcomes, to improve the education systems so that people want to stay in school and want to finish school because they have something to look forward to when they finish school. We also have great neighborhood improvement programs, recreational facilities, parks that have been developed over the last several years. We've worked a lot in terms of neighborhoods, in terms of nutrition, obesity prevention programs, smoking cessation programs, farmers markets, as Dr. Levin pointed out, in addition to grocery stores that in past years you couldn't find a good grocery store in your neighborhood. All of those things make for really, really great community health, and community health is truly that notion. So infant mortality rates reflect that, and so we've done really, really great things in this ward as well as other wards of the city. So when one gets to the specifics of health, or better said, when we think of the traditional health care, we think a lot about the things that go into a clinic like this. And as I mentioned, my two passions are really family planning service provision as well as infant mortality reduction strategies. And they really go hand in hand. When one thinks about how to have a healthy child, the most important thing anyone, any couple, any woman can do is to get themselves as healthy as possible before they get pregnant, to help them stop smoking, to help their partners stop smoking, to help them get their diabetes under control, to help them get their high blood pressure under control, whatever it is to make them as healthy as possible before they get pregnant. Adolescents are probably not in a great span in their life to be pregnant, so we have a role in our district as well as around the country. The unintended pregnancy rate is about half, 50%. Therefore, we have great ways to go to help women get as healthy as they want so they can plan their families. Family planning service provision is so key. So, but this clinic, as well as many community health centers around the city, really work to make a clinic, a setting, a community clinic appealing so that a patient wants to come and get care here, so that a patient knows that when she walks in the door, she's going to get care, caseworker care provision, social work care provision, medical attention from really great quality clinicians. Some of my colleagues that work in this clinic also work at the outpatient or inpatient care at hospitals. The Washington Hospital Center in particular is where I'm affiliated with. And so the collaboration between a community health center and an inpatient facility, a hospital system that's so strong and shares records and shares information about patients is so key to developing good infant mortality reduction strategies. As I started out talking about patients, I've learned a lot about my patients, and one of the things I've really learned from them is when we care about them, they indeed figure that they should be caring about themselves. If we care about our patients and we care about our communities, then they in turn will respond by becoming healthier. And that's really what I think we have a lot to be thankful for, and thank the mayor and the Department of Health for all the work they've done to develop great communities and great healthy outcomes. So thanks very much.
All right, we're going to take questions on infant mortality. But before we do, I want to introduce Tamika Young, who is here.
Yeah, come on.
Yeah. Yeah. And the reason for that, Joshua, what a handsome young man. Joshua is 3 months old, is that right? Huh? All right. Tamika and Joshua participated in the Healthy Start program. When Joshua was born, he was 9.6 pounds, 21.5 inches. Isn't it interesting how we measure babies in inches, and then at some point we don't know when they become tall, right, rather than long. And participated in the Healthy Start program, which is a great example. That included home visitations, regular home visitations, early prenatal care, proper diet guidance, and there will be follow-up care for Joshua until he is 2 years of age. And if we can follow that, if we can get our moms and our dads too, our moms and dads, to participate in the same way that Tamika has, we're going to have babies who are as healthy as Joshua is. By the way, isn't this a great poster over here? I am a healthy DC dad. Okay, dad. It isn't just the moms, all right? It's the dads. The dads got to play a role also. And it doesn't hurt to reiterate these messages. I will commit to being a father, which is a good start. I will keep my baby safe, and I will stay fit and healthy, which sends a great message to our babies as they start to get older. So we've learned over time that involving the fathers is as important as it is to involve the moms. Healthy Start doesn't say Healthy Start Mom. It says Healthy Start. And that means the recognition that fathers do play a role in pregnancy. Is that right? So, in any event, do we have any questions on the infant mortality rate or whatever? Sam?
What was the record high? I know you said that we have a record low now. Is that correct?
Yeah, the record high was, I think, the late 80s, early 90s. It was around 23. Yeah, 23.2. Yeah. I was just doing that from memory. Yeah, 23.2.
And you said as early as 2006. Was that 20, you said? Or?
Yeah, it was then. It goes to show how long it takes to start to change behavior. And that's how long it took to get people to start to recognize some of the things that Dr. Hathaway, Dr. Levin, and I, and Keene, Dr. Keene, I'll make you a doctor, and Vince Keene have talked about. Because it is some of the most intractable behavior that we're trying to overcome. I remember when we started Healthy Start, it was hard to get people to, we went in some of the public housing developments, Sam. It was hard to get people even to come out of their residence to take part in the Healthy Start program because people were suspect of what all of this meant. I see the gentleman sitting next to you, Leonard Watson, who works with me now. He remembers those days because he was involved in it, and people would say, you knock on the door, and people would say, no, I'm not coming out. No, I don't know what this is. What is this about? I'm sorry. No, I don't want to participate. And so it just took a lot of time to be able to overcome some of that.
Quick question also. I remember doing a story years and years ago. Is there some, I don't know if it's not a link you can really establish, but there seems to be numerically some link between homicide rates and infant mortality rates. I mean, are you able to talk about that, Doctor?
Well, we do know if there's violence in the home, obviously the pregnant mother is at great risk because violence becomes really physical, let alone the mental effects. And that, if you're pregnant, really has significant issues on the developing fetus. So you're right, that if there is sort of violence that is occurring within the community, it does affect it. As we always like to say, mental health is part of physical health, and that it does have its repercussions. And we do know that the more you are exposed to stress, your immune system reacts, which basically really affects also the growing fetus. So in some ways, I think there is the causality there.
I think, too, Sam, and you have a long history with these kinds of issues, but we're going to continue to focus on the east end of the city, and a lot of that will be around making facilities and programs and services available, just like the Anacostia Clinic. Some will remember, you will remember that there was a clinic beforehand, but it was basically run out of what could be properly termed a Quonset hut. down on W Street, down the 1300 block of W Street, which is not the most inviting place for people to go. And this is a very inviting place. It is a 21st century facility that we've developed here, and that's exactly what we intend to have at Parkside. Parkside is well on its way towards completion, and Bellevue is well on its way as well. So you can see here, again, recognizing the pitfalls of these kinds of data at the ward level, because when you're talking about 69 citywide, you're talking about very small numbers when you get to the ward level, so we have to be careful with that. But it still sends a message where we've got to do work. It's interesting too, Sam, that when you look at the unemployment data in the city, the unemployment data have been highest in wards 5, 7, and 8. And while I don't know that I can draw, a scientific causal effect between unemployment and infant mortality rates, I think we know that people not having a job certainly induces stress, like Dr. Levin talked about, and certainly until the recent past meant that some people were probably not even, either properly covered with insurance or didn't use their insurance coverage as effectively as they might. So, when you start to overlay some of these things, like you raised the question before, you start to see the relationships between them. All right, thank you all very much.
Thank you.